Welcome to Value-Based Care Insights, brought to you by Lumina Health Partners, a national healthcare consulting firm focused on improving the strategic, financial, and operational performance of provider organizations. On this program, we will explore trends and share valuable insights on how health systems and medical groups can optimize their performance to meet the demands of this increasingly complex healthcare environment and shift to transform the delivery of care. Value-Based Care Insights is hosted by Daniel Marino, Managing Partner of Lumina Health Partners. Daniel has been in the industry for over 3 decades and specializes in shaping strategic initiatives for organizations in areas such as population health, clinical integration, physician alignment, information technology, and data analytics. For additional insights, visit luminahp.com and sign up for our newsletter. Dan, over to you.
Welcome to another episode of Value-Based Care Insights. I'm your host, Daniel Marino. In today's episode, we're going to spend some time talking about strategic planning. Through a lot of the work that we do with organizations, through hospitals, through physician leadership, and so forth, we spend a lot of time helping these leaders understand what are their strategic goals, their strategic initiatives, how to align the organization around where they want to go as future goals and so forth. And some of the organizations actually do a pretty good job of activating the strategic initiatives while others struggle. And I've often wondered, well, what's the differentiator? Why have some leaders struggled with activating their strategic plans while others have really succeeded? And in having conversations with other folks, and in really thinking about the activation successes, it's come down to one important element, and that's the leadership. And what I've discovered is that as the strategic plan is being developed, it's equally important to continue to develop the leadership. I'm really pleased today to be joined by my colleague and friend, Dr. Doug McKinley. Doug is a clinical psychologist, has a tremendous amount of experience in leadership development. As a matter of fact, he wrote a fantastic book, The Resiliency Quest, where he spends some time talking about the key elements in leadership and motivating physicians and driving a lot of the goals that we've talked about today. Doug, welcome to the program. Very happy to have you here.
Thanks, Dan. Good to be here.
So, Doug, I know you've done quite a bit of work with leadership development, helping to pull teams together, helping to, help some of these leaders understand the key elements that are going to drive some of this success. And some of the work that you've done, maybe you could speak a little bit to some of the challenges that you've seen and why leadership development is so important for organizations, especially as they move forward with their strategies.
Mm-hmm. Yeah, thanks, Dan. I think some people don't prefer sports analogies, but I like them because they're kind of tidy. They're kind of like you had a season, like a strategic plan. And let me just say, if we were going to put a team together, and let's call it football since we're in that season, and we didn't plan for players being injured, or we didn't plan for any adversity, and we just say, we're just going to have a great year, and we build a strategy, here's how we're going to win, and we don't really think about the players and their resiliency and how they're going to play together, it would be kind of silly, right? So I think the thing I run into is people Dan, you know this, sometimes they don't even really have a clear strategy. So that's point number one. But if they do, let's assume they do, if they haven't really taken a time to think about who's going to be actually acting on that strategy and what the verbs are, what the behaviors, the success behaviors are that are going to help us accomplish it, it's going to be a real conundrum. So I think the biggest challenge I run into is people just don't think about leadership and team cohesiveness as a strategic anchor. They overlook it.
I absolutely agree with you. Absolutely agree with you. And when we work with organizations, and I've had the opportunity to work with many hospitals, health systems, physician groups around the country in developing their strategic plans. We focus on four things, Doug. We focus on kind of defining the why, what, and how you're going to do it. We then focus on the value proposition that really speaks to the goal and what you want to get out of the strategic plan. Third, we really focus on what is going to be required for success, that commitment. But the fourth element that we talk about is culture. Now, we don't go into the culture drivers, but we really assess whether the organization in their current state has what it takes to achieve the strategic goals, or is there a evolution that has to occur in their culture? So given those four elements that I talked about for strategic planning, in your opinion, how does the leadership development need to complement the strategic planning process?
Well, first of all, it needs to, right? So it needs to be considered. So if we're going to do that, and it's again, if you don't assess culture and the vehicle through which you're going to drive your strategy, it's just a big mistake. So I think they need to be complementary. A lot of times when I listen, especially when I watch you lead a strategic session, Dan, and I look around the room and I think there's no way this team could pull that off. I love what you're coming up with, but I'm looking at the players, and first of all, we don't even have clarity or agreement. I think agreement's an undervalued, I don't know what to call it, an undervalued competency. Getting to agreement as a leadership team and as a cross-functional team is really hard, and you can't just assume it.
No, I agree. I agree. You know,
good. You've got agreement. Good.
we've spent some time talking about that, and I think, you know, the basis of agreement is trust. And
right.
You're a huge proponent of that. You've talked about that, where there has to be innate trust in the leadership team. From there, you know, you kind of speak to accountability and driving results, and frankly, that commitment, which I think is critical in that strategic planning process. And oftentimes what I see, to your point, is that that's really overlooked. I don't think the leaders really look at that. And maybe it's because they don't want to put themselves out there and they don't want to be vulnerable. But I think as we start to think about the successes of these plans, you can't activate them or activate them properly to the success that you want if you don't take those things into consideration.
Yeah, they say that culture eats strategy for lunch or something like that. I forget. Is that what the phrase is?
Yeah. Culture eats strategy for lunch every day, something like that.
Yeah. So if that were really true, if people really believed that, then this conversation wouldn't be so novel. I just don't know that people really have agreed on that or not. It's a nice posture and it's a nice marketing message. And the times when I get in and really start rolling up my sleeves working on culture, people really want to get to the tactics and the behavior, get to the solving problems. They don't really want to talk about culture. So it's a big challenge. I get it. You know, if you're a results oriented organization, you just want to drive for results. You want to get things done. And my suggestion is that you just have to take time to pull back a little bit and stand back and look at how you're working together. And so, yeah, the four things that you have, your four things, the four things that I'm trained in, being part of the Kappa Pro, table group Lencioni program, is that we have to have team cohesiveness. Then we got to build clarity, which is the strategic plan. Then we have to over communicate that plan. And then fourthly, we need to reinforce it and hardwire it into our behaviors. So that team cohesiveness is, again, people just assume that because we're a team, we're going to work well together. And that's where these 5 behaviors become critical. And I think that's one of the things you wanted me to just touch on, Dan, with those 5 behaviors.
About the 5 behaviors, because again, I feel like those are either sometimes are taken for granted, or it's in speaking to many of the leaders, you get so wrapped up in the day-to-day activities there's a lot of pressure on these leaders today, right? So we do a lot
Right.
of more crisis management and a lot of our daily activities than we do a lot of planning the day, so to speak. And understanding these behaviors that are critical in driving the success, everything starts from the top, right? These leaders have to provide a good example to their middle managers, to their staff. And I've heard you speak about these behaviors. Why don't you spend a couple minutes going over them? I think that would be real helpful.
Yeah, let me just quickly, and they were originally, the author originally outlined them as dysfunctions. So he basically said that the five dysfunctions of a team is the inability to have trust. And if you have no trust, then you're clearly not going to have healthy conflict. And if there's no healthy conflict, then how are you going to agree on things to a commitment, which is the third behavior? Well, accountability is the fourth dysfunction. There's just, what are we holding people accountable to if we don't have those those three things in place? And then the last behavior is your results. So trust, conflict, commitment, accountability, and results. And the results, I could be very productive. It's like a sports team analogy again, Dan. I could be a great athlete and our team could suck, right?
Right.
The results have to be that we win together as a team, not that I'm building my stats. And we work in healthcare, and it's easy for really great clinicians, nurses, doctors, all of them, to feel like, hey, I'm doing my thing. I've got my surgical field in, and I'm really good, and forget that they're part of a huge ecosystem.
Yeah.
And so the results have to be focused on those. They have to be focused on organizational wins, not personal wins. Go ahead.
So it was we obviously did a lot of work in supporting many healthcare systems during COVID. And I saw many of the leaders in their response to COVID took a very top-down approach, right?
Right.
Type of an approach to figuring out how they wanted to respond to COVID, manage some of the interactions with doctors and with patients, telehealth being one of them. Basically said, we're going to do telehealth and we're going to implement it in the next couple of weeks. So it was a very authoritative type of a style of leadership that many organizations put in place. And frankly, I think it was needed, right? And because it was a scary time, many of the staff and employees, of course, looked to the leaders to provide that level of direction. And I think many of the leaders did a great job responding. But I also found a year after COVID that it's been very difficult for the organization to get back to more of a decentralized sort of management style where you're able to delegate some activities there and ensure that there's some level of accountability. And I don't know if it's because the leadership certainly has some bruises and certainly some still the recent ones and thinking that occurred within COVID. But some of the things that you've mentioned, driving commitment, accountability, building that trust, I believe many of them want to, but it's been very hard for them to get back to where they were from a management style pre-COVID in this post-COVID environment. Any thoughts with that?
Yeah, I think it's very simple. It's because they didn't trust the people to help them do it. We call this heroic leadership, Dan, and that's what happened during COVID. Is the organizations that were not healthy already, they had to enlist heroes. They had to bring in superpowers to pull off this heroic measure, and they saved the day. Then you go back and everybody felt like, well, I guess I'm not that important because the person with the cape flew in, saved the day, and there's some amazing people out there that did do heroic things, but that's not a healthy organization. That's a top-down or a specialized thing, and so they've lost the trust of their players. The people all want to feel appreciated and valued for their strengths. And when you go into heroic leadership moves like what some organizations did during COVID, then you're basically putting people on the bench and they feel discouraged. So we've got
Right.
to, it was a mistake if they did that. And now it's not a matter of going back to the way it was. It's a matter of actually creating a healthy organization so that they can actually allow people to use their beautiful gifts. So yeah,
Right.
it's a real challenge.
Yep, you're absolutely right. If you're just joining us, if you're just tuning in, I'm Daniel Marino. You're listening to Value-Based Care Insights. I am here today with Dr. Doug McKinley. We are talking about the need to align leadership development with strategic planning and the successes and the challenges around that. So Doug, when you think about organizations on kind of building that trust factor, um, what are some of the key things that you see or that you're working with some of the leaders on building that level of trust? And it kind of gets me back to one comment that I've heard you make plenty of times as you've worked with, as I've had the opportunity to work with you on different engagements. You've mentioned that healthy adaptive leadership creates effective strategy. So when you think through that comment, when you think through that quote, trust has to be an underlying factor, right? So
Sure.
what are some of those key things that you begin to work on with leaders that helps them kind of advance or pull together that trust factor?
Well, I think the key word in that quote is adaptive, right? So if let's just say today's we're whatever day, let's say today's a Wednesday and we go out and we plan our day, and if it's like most operational things, it never goes as we plan. And so for me to be so rigid in how I want to get things done, so as to say it's got to go my way, it has to go perfectly. If I'm not adaptive, then how am I going to enlist trust and vulnerability amongst the team where we can actually juggle those tender moments? So I think the first key of building trust is we need leaders that are willing to be vulnerable and admit, hey, this isn't going as we planned. We need to pivot right now. And I need to tell you, I'm not sure where we're going. I'm not even sure what our next move is, but I'm glad you're with me and let's do this together. As opposed to what I think heroic leaders do is they hide that and then they just drive expectations without enlisting their team. So
Right.
trust is a currency, and it's alive, it's dynamic. It ebbs and flows like sort of a current, like money does, the value of something, and you have to value it. Trust is a currency. You have to value it and not break that trust by demanding or yelling or being disappointed in people when things don't go as planned, because they often don't.
And
So that's
I
one thing.
love that. Trust is a currency. I absolutely love that. And when we work with organizations, with leaders on developing their strategic plans, their strategic initiatives, it's really that, right? I mean, nobody has a crystal ball. You don't know exactly what's going to happen in the
Right,
next year, 2 or 3 years, right? So it's a
right.
little scary, but you've got, I mean, you really, the only thing you have that supports that is trust. And you need to have trust. But one of the key things that I think that you've alluded to as you think about, as you talk about that adaptability, it's really around being agile and I've heard you talk about this before, being a highly impactful agile leader and the competencies that go into that.
Yeah.
And what I've seen is I kind of think about the different health systems and those CEOs that have been successful. Some of the key attributes that I found is they're not afraid to be vulnerable. They're not afraid to admit a mistake. They provide strong direction to their team, and they really focus on being on developing that trust with their immediate team, but also with more of the junior managers as well as the employees. How does being an agile leader, or maybe the agile leadership competencies that are so important, how does that figure in?
Well, it starts with trust, right? So you have to. I think the where I, if you were really listening and this made sense to you, I would start with, do I trust myself? So I think self leadership is another undervalued competency. Do am I clear about who I am and what I'm doing and why I'm doing it, so that when I am engaged with my teammates, they're clear about who I am. So I think self leadership is one of the key things that if you're clear about who you are, then you can show up in a in a way that allows the people around you to feel comfortable with you. And the first thing you got to do is, if you're wrong, you got to say, you know what, I'm wrong.
Right.
I don't hear that very often. I don't know about
No.
you, but it's you know what, I was wrong. I was wrong about you. I was wrong about the strategy. I overvalued, the market trends, and I'm sorry. I got us off track. What do you guys think? Right?
Yeah.
Just
You
be a
don't hear that
human.
very often. Yeah.
It's that's adaptive. It's being honest to the moment. Yes, last month we said we were going to go here. It's not working. Let's just admit it. It was my idea. Instead, what I usually see is people say, well, I don't know who came up with that idea, but that was dumb. And then we judge and shame each other. Now the trust currency bank account goes down. And Brene Brown says that vulnerability is the precursor for innovation. Like, if you really want to have an adaptive, innovative strategy that can be flexible in the marketplace, you have to be vulnerable with each other, and that
Yeah.
comes that
Right.
comes through being honest, and and building trust with one another. So it's I know I'm kind of it sounds squishy, but it's not. It's actually real business savvy to be to build trust bank accounts with your team.
Yeah. No, I agree. And, we're faced with so many challenges, right? Those characteristics around strategic planning and strategic initiatives and leadership development are so critical, Doug, to driving the success of organizations.
Yeah, and it's interesting. If, let's say, you have a great leadership team, and I know you and I both worked with them, you have to assume that somebody on that team might leave, right?
Right.
They're gonna get recruited somewhere else. And so if you don't have a way, an ecosystem where trust and vulnerability is valued, you're not going to be able to pivot when that happens. If
Yeah.
you're an orchestra conductor, and your first chair violinist, or your solo artist leaves, you don't not have the concert. You have people in place. You have a bench strength. You have a system, an ecosystem where people want to step up and be a part of leadership. And so this isn't about building the perfect team. That's what I tell people all the time. You're not trying to find exactly the right people with the right chemistry. It's actually it's practicing these five behaviors in a healthy way, and people can come and go off the team, and we all can work together.
Yeah.
And
I
that's a
agree.
big distinction. Yeah.
Big distinction. But I think if organizations, and it's a journey, right? I mean, you don't just flip the switch and or buy a program or read a book and put these things in place. It is
No.
a journey
Right.
as organizations go through this. So, in closing, Doug, for a lot of our listeners today, any pieces of advice, any words of wisdom, other than the conversation we had, a lot of wisdom and a lot of great insight here. Any final thoughts you might want to share?
Yeah, I heard a really Patrick Lencioni gave a nice term recently that I'm going to share with your audience. He called it organizational health insurance. He said we're heading into a tough time. We just came out of a tough time, and now we're likely going into a recession. And I really think you need to sit down with if you're listening to this and you're on a leadership team, sit down with your leadership team, and just look at what are the key indicators of what it looks like to be. A lot of teams want to be smart and not healthy, right? I'm sure most of the people on your team, including you listening, are smart, but is it a healthy environment for where people can actually plant their gifts and really invest and do great things together? So I would say sit down and build an organizational health insurance plan, which is build a cohesive team and get clear about who it is and what we're trying to accomplish.
Exactly.
Strategy is great, but I really believe culture and team and healthy organization is probably I don't know if it strategy for lunch, but it's equally as important. So
I agree.
just
I mean,
take a minute and think about it. That's all I'm asking people to do.
You need to really have both of those elements, and it is so important because, having one and not the other, you won't be successful. So I agree. Well, Doug, this was great. I want to thank you for your time. I know you're very busy. Real quick, if anybody wants to get a hold of you, any thoughts on how they can reach out? LinkedIn?
Yeah, my website is dougmckinley.com. It's pretty easy. So you could find me there. I have a podcast like you, Dan. It's called Leadership Currency Podcast. So you can find that through the website, dougmckinley.com. Thank you.
And it's a great podcast, so I commend you for that. And I love listening to great topics. So I want to thank our listeners today for joining in. Hope you enjoyed the conversation as much as I did. Until the next insight, I am Daniel Marino, bringing you 30 minutes of value into your day. Take care.
Are you at a crossroad with value-based care? Do you need to chart a future strategy or improve your organization's performance? Visit us at luminahp.com to learn more about our professional advisory services and leadership development programs. Also, you can sign up for our newsletter on our website and follow us on Twitter and LinkedIn. To connect with Daniel Marino or for more information about the show, visit our website or healthcarenowradio.com. Join this conversation using our hashtag VBC Insights. We are Lumina Health Partners. Thank you for joining us today. Until the next Value-Based Care Insight, stay well.